Hi everybody, welcome back again. This week we're going to talk about pregnancy, low back pain. Is it common? Why it comes? And one is not like the other on this video, so I actually have a sidekick who so graciously decided to join me, but she's very pregnant, and so we're just grateful. But I figured that would probably help a little bit, gives a tad more meaning, and it also helps us close the loop as far as how we actually help pregnant women feel great, deliver great, and sleep great most of the time. So let's go through a little bit of an anatomy lesson here. So if I had a spine that was sitting sideways like this, right? Let me adjust it to the, more of an appropriate posturing. So as belly starts to get bigger, obviously you want to be able to carry it without a whole lot of issues. But it starts stretching ligaments that attach down here at the pelvis. This is good education for you too, right?
Yeah, I like it.
All right, so if we have them facing forward, this would be as if Amber was sitting here. But as the ligaments that hold the pelvis in place start to broaden, right, to help support the weight of the baby, what happens is the angulation of the low spine starts to change in order to support the weight. So that would be as if you're going to the gym and you want to lift heavier weights, right? You need to be able to support and reinforce that. So when a baby starts to develop, right, you're taking what you already had, right, and now you're expecting the body to handle more load. So a lot of my very active people who have consistent healthy routines before they get pregnant oftentimes fare a little bit better before getting adjusted than others, just because the load on the body, you've already trained it to handle the load. So as the spine starts to get pulled more and more in order to handle the load of the baby, oftentimes we call this like hyperlordosis, meaning that the spine is actually sitting in a position that it's not normally trained to be in. So it taxes the muscles and the ligaments in the low spine in order to help protect the baby, right? So one of the things that we often talk about with our pregnant moms is this idea of how do we help them continue to grow, right? Healthy baby, but also stay healthy and functional on their own, right? That's ever evolving as a person. But one of the things that we oftentimes love with our patients is that they get to lay on their stomach while they're pregnant. So if you are not pregnant or you haven't been around someone who's pregnant, as they start to get bigger, it becomes very cumbersome and almost unsafe to have them lay on their stomach, right? So you kind of end up, where do you put the belly? You don't. So most people start laying on their stomach or on their side or on their back, which is also very complicated. So I just wanted to show you the pregnancy belly, just because, we get a lot of questions in the office, what pieces and parts go in what section, but this allows our growing moms to be able to lay on their stomach. I know, you're surprised because you know where the pieces and parts go. I've had people who ask, and I will explain it all day, every day, but this allows mom to lay on her stomach as she continues to get larger, further into her pregnancy, without a lot of labor on her part. So if you can have a mom lay on her stomach, even for 5 to 10 minutes, unloads the spine in a useful way that they don't normally get to experience at home. So you got adjusted before you were pregnant.
Yep.
And you were consistent with it and felt good.
Oh,
right?
yeah, for years.
So now that you're obviously far enough along in your pregnancy, right? Getting adjusted is important, right? Because you don't know what's coming down the pipeline, right?
No, and I feel like I've kept the pinching in my back, where the last time I was pregnant, I had a lot more pain in my lower back, and I haven't had it as much as what I did before.
Good. So the win for not having low back pain is that all the other things that she has to focus on in life can, take center stage. Low back pain oftentimes limits us from doing other things, and we don't want that either. So we just wanted to take an opportunity to just why low back pain becomes so important to work through while you're pregnant, but it also helps to set the body up for, and now you're not working through low back pain, now you're helping to set the ligaments and all that up for a really smooth delivery as well, right? Which, is the ultimate goal when we get to the end of this. So thanks so much for your help.
You're welcome.
I always appreciate you. And if you've got more questions about pregnancy, low back pain, please comment below. And until then, just send good vibes to this mama that everything continues to go well and that she keeps her sanity in the process. We'll see you guys next time. We hope you enjoyed today's topic. If you like it, please subscribe and ring the bell for more topics related to this one.